Hi, I'm Sally Woodhead. I'm the Cancer Application Specialist at Episoft, which is an e-health company based in Brookvale on Sydney's northern beaches. My background is in oncology nursing and as a clinical trials coordinator. In 2013, we were awarded a grant from Oz Industry to develop a new software program for day procedure centres providing chemotherapy and other infusion-based treatments. Where's my clicker? I didn't realise it.
You can just use the arrow.
Oh, okay.
Here if that's,
Lovely. Thank
right.
you.
Yeah.
There's my lovely cloud picture. These centres were typically using up to 3 software products to cover their information system needs. They were often not integrated with each other and had gaps in function requiring paper-based record keeping for some of the clinical workflow. Episoft felt there was a significant market need for a single integrated information system for these hospitals that could enable them to deliver cancer care more effectively, efficiently and safely. The project had 2 main aims: to assess the feasibility and market acceptance of a cloud-based software program for cancer care, and to evaluate whether the functionality of Episoft's existing protocol-based care module, then in use for shared care in other chronic diseases such as hepatitis, could be extended to incorporate the complexity of cancer management following the EverQ guidelines. Together, in a collaboration with Cancer Care Associates at their newly opened site in southern Sydney in 2014, we were able to beta test an extensive range of chemotherapy protocols and practice management functionality. This allowed our CareZone platform to rapidly mature to support cancer treatment delivery. We also beta tested the system with a second beta site that provides skin cancer screening and tracks the progress of lesions over time. This company didn't use chemotherapy, of course, but it did allow us to beta test on a significant number of patients, the appointment management and integrated scheduling workflow on their mobile nurse workflow throughout Australia and New Zealand. They have over 80 sites. The system we developed incorporates protocol-based prescribing, appointment management, medical record keeping and non-protocol prescribing, pharmacy ordering and nurse drug administration, as well as an integrated e-claiming and billing module which electronically sends the transactions through Medicare and the health funds. The private hospital billing system was far more challenging than we had anticipated and accounted for 20% of Episoft's research and development expenditure in 2014 and 15. This was almost as much as the protocol-based medication management system, which accounted for 22%. The product matured sufficiently rapidly to be selected as the clinical system for a busy day infusion centre at a large 500-bed private hospital in Sydney. It has since been implemented at 5 centres in New South Wales and Queensland, 4 of which are using the software as a service internet version, demonstrating a market acceptance of cloud-based solutions. A further 4 sites are in plan for implementation. Cancer management software requires a lot more complexity and functionality than most other chronic diseases do. Episoft's CareZone software already had a protocol-based care module, but it needed to be tailored and enhanced to manage cancer treatments. Initially, all the oncology and haematology protocols using the Cancer Institute's EverQ guidelines needed to be transcribed into CareZone. While we'd established dose calculation rules using body surface area, area under the curve and capping of dose, as well as dose reduction rules, prior to releasing the system to our beta site, specialists in the field wanted a number of changes and enhancements. They wanted to be able to lock the dose to changes in weight, and they wanted to be able to cap the BSA at any level. Adding medications to a protocol phone orders, standing orders, nurse-initiated medications needed to be refined and enhanced with user input as well. The result is an intuitive, workflow-oriented, patient-centred program. There is a seamless flow between the administrative and clinical process. The patient sees the clinician, and once a protocol is prescribed, the clinician is able to sign the protocol medications electronically. The patient may be entered into a clinical trial, and the appointments in a protocol flow immediately to a booking requests folder for administration staff to book. As soon as the appointments have been booked, pharmacy is notified that drugs need to be ordered. Pharmacists can track drug orders, drugs received, and unused drugs to avoid high-cost drug wastage. Pathology results are electronically imported into the system. Once booked, the appointment can be attended, and nursing and medical staff have a variety of forms that can be completed, such as the nursing patient assessment, staging and morphology, adverse events, etc. When administering medications, nurses can e-sign the drug administration chart, record vital signs and other outcomes of treatment. Reporting capabilities are well developed at Episoft, with standard and customisable reports available to researchers. We're currently working on reports that can help identify patients for clinical trial eligibility. Quite topical at the moment is the dose variance report, which is being worked through with a beta site and includes tracking dose variations by a number of different methods and includes the reasons that have been recorded for reducing or increasing the dose that has been recommended by Everq. Security and reliability are uppermost in the list of requirements from our clients. The Episoft system runs in a highly secure ISO and ASIO T4 accredited data centre located in Sydney. It has a 99.999% uptime guarantee. Software performance speed is an ongoing challenge when delivering a web-based technology platform with no installed components. Our aim is to achieve the same level of responsiveness as desktop applications over the internet. We continually monitor the various pages of the application, the infrastructure and the database queries to optimise performance. As you can imagine, a number of the pages in the application contain large amounts of data and scripting, and these can be slow to load at times. One of these was the protocol authoring module, which rendered the entire cycle of care, including drugs, appointments, sometimes tasks and tests, into a single page. This worked fine with short protocols, but when you had a longer protocol with several days of treatment and various different drugs over the different days, it could result in a slow page load time. We've recently redesigned the protocol authoring module into a simple tree structure and broken up the content over multiple pages, with the result being vastly improved performance. We're about to release that soon. In 2013, with many hospitals and infusion centres using paper-based systems, or a combination of paper and one or more electronic management systems, the need was increasing for a system that encompassed all the features required by an infusion centre, such as prescribing and administering medications, recording notes, scheduling appointments, pharmacy ordering in one product. We know that using paper for patient records might be quick to write down quickly when you're administering drugs, but it has inherent problems such as illegibility of handwriting, cost of copying, transporting, storing the data, creating volumes of medical records that require storage in a warehouse. Paper records deteriorate over time and with frequent handling and are vulnerable to natural disasters or human error and become lost. Paper records are not easily shared with other health professionals, requiring retrieval from storage, scanning, faxing, posting, or emailing, which is not secure. Episoft's online system also enables record sharing with other health professionals outside of the hospital using the platform. This could be GPs involved in shared care during or after the acute treatment phase, or if a patient has an infusion-related reaction and is transferred to emergency can access the patient's file and see what's happened that day. It's also available to clinical trial monitors to allow remote monitoring, which will be a significant cost saving for pharma companies. We also recognise that a cloud-based platform is not for everyone, and so during 2015 we worked on a version of the system that could be installed in the hospital network, integrate with other hospital systems and with seamless login for clinicians in the hospital network. This network installed version has been implemented at one large hospital site. Cloud-based electronic medical records are the way of the future, with a number of practice software systems now moving their technologies to the cloud. Users need a system that is cost-effective, that uses sophisticated security measures and has secure data protection in place. They need a system that is responsive to the needs of users, easily upgraded with new features, and with the ability to access the system anywhere at any time. This project was a great example of a New South Wales-based innovation and collaboration. A New South Wales-based e-health company beta tested its new cloud product incorporating the New South Wales Cancer Institute's EverQ guidelines, which are world-class, at a New South Wales hospital. With 46% of all chemotherapy delivered in the private hospital system, this sector is a major source of real-world evidence of the effectiveness of new treatments. Applying Episoft's proven ability to link data from disparate sites in real time to cancer will give health professionals in the care zone community insights into their patients' outcomes and treatment practices relative to others, and will bridge the information divide between day-to-day care and investigator-initiated collaborative research. Thank you.